Welcome to Cyprus Facial Surgery.
This is DrNeo. I made this channel to keep you updated and demonstrate my work. Stay tuned with us. Cyprus Facial Surgery at YouTube. Welcome to Cyprus Facial Surgery. This is DrNeo here today. And of course, we're a primarily cosmetic service. And we decided though to give you an update due to the high demand in regards to this new disease of coronavirus. What I'm going to do today here, I'm going to explain you all the basics of coronavirus, what you have to have in mind, what you should be avoiding of, what you should be protected from, and what are the symptoms of this disease, how serious this disease is, and what should you do in your daily activities. Let's see on the monetary front, of course, what this virus is. This is a small virus, it's a small actually living organ that affects the lungs primarily. So all of the initial problems that we get and final problems that we get, they will affect the respiratory tract, which means the breathing and the lungs. So this virus is a respiratory virus, which means that affects the lungs. And of course at a glance, how this virus is being transmitted. As you can see here on my screen, the COVID-19 is a virus that actually transmitted through the droplets that generated via the coughing or the sneezing. So when I cough or when I sneeze, I spread this virus around me, and as the study shows, every person who is close to me in a distance of a meter or a meter and a half, it get affected. So safe distance to keep for a person behind you or close to you is 2 meters to be safe when it's coughing. Again, if you're unprotected or if the person is unprotected, doesn't wear a mask, you don't wear a mask or you don't wear actually an eyeglasses or something to shield your face, these droplets can go into your clothes and you are already infected by somebody coughing or sneezing. Now, if you get infected, all right, how are you gonna behave? COVID-19, it causes similar symptoms to the flu. So at the beginning, most of you're going to develop some fever. 88% of the cases, we have a fever. Later on, we're going to start developing a dry cough, like, but with no production of sputum. And then, furthermore, we're going to start feeling ill. We're going to start having sometimes diarrhea, sore throat, like a flu. Sometimes we're going to get a headache or short of breath. Now, these symptoms will actually come progressively. They're not going to come immediately. So the coronavirus incubation, means the growing of the virus into your body, it takes up to 14 days. Mainly, the majority of the population, it will show the symptoms between 5 and 6 days, the initial symptoms. Be careful, because at the beginning it may show like a small incident of flu and it will not hurt you, or you may believe that you have actually a little bit of headache or a little bit of fever. Please, if you have any of those symptoms, visit your primary care physician and go for a testing. How sick do people usually get? That's when a myth comes and when the reality and the truth comes. 80% of those people that get affected by the virus, they will recover. They have a very mild illness, which is rarely involves and needs any hospitalization. So somebody with this disease, he may stay home and he will recover just fine. The majority of us, when we get sick from this virus, will recover fine. Though we have to stay home, we have to be isolated, we have to stop the chain of contamination among others, because as you're going to see later on this presentation, there are some people that are seriously actually at risk to die from this. Of course, 20% of the people that get infected, they're going to run to the hospital with moderate to severe symptoms and illness. And 6% of those patients, unfortunately, it will become seriously ill and they will actually request an intensive care treatment. Of course, according to the global statistics, 4% of the people that get seriously ill, may die from this disease, the people that go to the hospital. So the mortality rate of this patient is approximately 4%. Unfortunately, nowadays we have some change of this virus, and as you can see in Italy, as you can see the diagram here, I move up and down. In Italy, up to 80.3% of people, they die from this disease. So we show that the more you get infected, the mortality will be bigger. And of course, I'm going to answer a couple of the questions that you ask me when you call my office all the time about this disease. Can you be reinfected? It is too early to know if somebody who has a disease and get cleared can be reinfected. That has to be if a strain of the virus will mutate and change character, like a flu change, and people, they get the flu again and again with a different type of the virus. We don't know yet if it's just one strain or there is a mutation. But prophylactically, we have to understand that all of us, we should stay under precaution that maybe we can get reinfected. Can I be infected if I don't have a fever? Yes, you can still have a coronavirus if you don't have a fever. This is a cases of 12%. Don't forget the diagrams I showed previously. 12% of the people, they have a very mild disease. Not even a fever, not even a symptoms, especially young patients and children. It shows that children have almost to no symptoms, but these babies are very, very contagious. They can spread the disease among the society. How long does it take to get sick? Normally, most of the people, they start showing symptoms of a regular flu in 5 to 6 days. Though the incubation period, the growing period of the virus, it's up to 14 days. That means that somebody may stay asymptomatic for 14 days, for 2 weeks. That's why we keep people in isolation for 14 days, for 2 weeks. If they don't show any symptoms in 14 days, it means that they don't have the virus, right? So from the day that you have or have a suspicion of being infected by the virus, you should stay in isolation for 14 days. How sick do people usually get? As I said previously, don't be panicking. 80% of us, we get well with no need even to go to the hospital. 80% of us, we're going to recover from the disease with no having any need of hospitalization, like a regular flu. Unfortunately though, 20% of the population, you will need to go to the hospital, and from these people, 6% of the 20%, it may become critically ill and end up in a ventilator. And unfortunately, that's where the risk comes. Some of them, they will die. A patient who goes to the hospital, it seems, according to the data, that from the day that it develops the first symptoms of a very mild flu, in a week period, it may become seriously ill. So this week should be critical for this patient to be in a hospital and, of course, to be actually isolated, to get all the support, all the new and trial medication that we do today. And of course, these patients don't contaminate more patients. How often do people die from it? That's a question that everybody asks. Of course, this disease that is not a lethal virus, it doesn't kill everybody. Unfortunately though, it will kill 4% of the infected people. 4% of the infected people will die from this virus. And according to the new statistics in Italy, that we had a huge spread in Spain and United States nowadays, this number escalates up to 83%. 83% of these patients may die from this virus. Is that actually varies from country to country? We don't know yet. It seems that the virus may become more aggressive in one actually mutation than the other, but still the statistics are there. And since we have to protect our society and ourselves, we have to keep the measurements since we don't know much about this virus yet. How does coronavirus kill? It's another question that many of you will ask me. How this thing will kill me? Why the other person next to me gets well? It has something to do with me, with my immune system. So how the case actually of fatality comes, the coronavirus, what it does actually spread into the lungs. is spread into the lungs, and of course, it depends of how much of a reaction the body will actually give to these lungs. At the beginning, some of us will just get a dry coughing, some headaches, some fever, some fatigue, malaise, be feeling ill, and will pass, and the virus will actually get immunity and of course get antibodies and get rid of it. Unfortunately, at 20% of us will develop a disease of the lungs named as pneumonia. Pneumonia is when this virus goes into the lungs, affect the cells of the lungs, and of course an immune reaction to this virus starts from the body, which actually attack the virus, but at the same time destroys the cells that they die from the virus into the lungs. That, what it does, it just fills the lungs, the air fluid with fluids, the air actually, area of the lungs that is made to exchange gases and of course to oxygenate the body, it gets full of fluids, and this exchange of oxygen stops. If this area is a small area and the rest of the lung, okay, it does its work, then it's a simple pneumonia, we treat it, you will recover. But if the whole part of the lung gets crazy and attacks the virus and you get a full fluid inside your lungs, then you develop a very bad syndrome, as in simplicity I can explain, the ARDS, acute respiratory distress syndrome. If you develop this, then you cannot oxygenate yourself because your lung is not there to help you by breathing, and then you need support by mechanical ventilation. At this stage, you have to be intubated and be in the intensive care unit. And unfortunately, at 20% of this population that are going to need intubation, they will actually die. That's actually how this syndrome kills people. Who is most at risk of dying? Yes, the elder people and the people that they have underlying disease, they have a higher risk to die from this coronavirus. Approximately people above the age of 60, okay, and if they have another underlying symptoms and disease, they have higher risk to die. For people aged 60 to 69, the death rate is up to 3.6%. From people of 7 to 79, it comes up to 15% the risk to die. And of course now, from people to 60 to 69, from 3.4% from the initial actual studies in Uganda, now it raised up to 8.3%. That doesn't mean that people under the age of 50 have no risk, because according to the statistics of the World Health Organization, people under the age of 50 still, they have a very low, but still they do have a chance to die from this virus, and approximately 0.2 to 0.4% of those people, they will die from this virus. And the new statistics that they come up from Italy and Spain, where the virus is spread all over the place, they show that even young people, up to 1.3%, they will die from this virus. So you're young, don't ignore this virus. This virus will get you and maybe will kill some of you. Be aware and protect yourselves. How infectious is it, and how does that compare with flu? Now, this virus, as I told you, is very contagious. It can spread easily from person to person. Whoever is infected, even this 80% that is asymptomatic with mild symptoms, have a very mild disease, can infect everybody. And of course, this 80%, it will infect everybody very easily by coughing or sneezing. If you talk to them, if you come close to them, if you get a coffee from them, if you get money from them, if you shake hands together, this is ways that this virus can get into your body and get you infected. And if you're the lucky one, you're going to be in the 80%. But be careful, you may be one of the unlucky ones that you're going to be in the 20% that are going to need more treatment. Of course, compared to the regular actually influenza, this is a very heavier actually symptomatic infection. And of course, people in influenza, they get sick after the infection approximately in 3 days. With this virus, we have to wait 5 to 6 days, up to 14 days to get the first symptoms. The fatality of the COVID-19 is higher than that of a seasonal influenza. The seasonal influenza, the common flu, kills approximately 0.1% of the people, because most of us, we have vaccine against it. 0.1. Now we have this virus that kills 4% of the people. So you can see that the mortality is significantly higher of this virus to a common flu, 0.1 versus 4%. And of course, again, the question if you can be infected, on the basis of what we understand about the coronavirus, it is likely that infection will give you long-term immunity. Yes, most likely, because we don't actually worry about the strains. Whoever is getting infected and develops immunity, it may be immune. It's not clear yet. It's unclear. So we need to wait for a year or two to see how this virus will behave in the population of the people that they get infected. Basic things to remember, and don't panic. Stay home, protect yourselves, wear your mask, sanitation stuff, and of course, you can actually be aware of people. And if somebody of you gets sick, should call immediately your primary care. You should understand that this is a disease that actually kills people. It will not kill everybody. And if you get infected, don't be afraid and get panicky. Most of you will recover. The most important thing is to be diagnosed, to be isolated, not to contaminate more people. And here is when actually the most important thing comes. The major problem in our country is if all of you will get infected. It means that 1 million of Cypriots, you will get infected. It means that 20%, which is 200,000 people, they will need immediate hospitalization. Unfortunately, not in Cyprus, but in any other country, we don't have so many beds to accommodate you. So many of you that you're going to get infected, if all of you get infected at once, they will die not because of the virus, but because of the inability to provide you the basic medical care. And the worst thing is, this 6% of the people that they will end up seriously ill, which about 60,000 people, if they get infected immediately, if the virus infects immediately all the population, they will need intubation. We do not have 60,000 ventilators. No country has that many. So again, these people, that some of them, they could be saved, they will die because of the lack of medical care. What we should do, we should actually restrict ourselves to home, limit ourselves to the necessary movements, avoid socialization. It's not the time for socialization for anybody of you. And of course, my office and my staff, we stay in the office. We are the first line working for you. You can give us a call for anything you need. We will advise you. We will send you every information we need. We can direct you. And here at American Medical Center, we decided from as of Monday to test everybody who needs admission to the hospital for coronavirus. If you have a surgery to do, you can come to the hospital. Of course, you have to understand that 24 hours before your surgery, you're going to need to be tested for the virus. And if you're negative, we proceed with your surgery. If you're positive, we proceed with your treatment. We need to do that because we need to protect you and all the other patients from coronavirus. Thank you very much. Keep staying with us. This is DrNeo from Cyprus Facial Surgery. I will keep you updated with anything comes about this disease. And of course, hopefully all of us will recover and come back to normal.
Thanks everybody for watching, much appreciated. If you like this video, click the thumbs up button. For more information, check out these links. And if you're new to our channel, please do not forget to subscribe and to turn on your notification with the bell icon down below to get all of our new updates in your feed.